The first bill on the calendar for the day is Senate File 475. The clerk will report the bill.
Senate File number 475, number 1 on the calendar for the day, an act relating to health, the first unofficial engrossment.
I call on the member from Hennepin, Representative Freiberg, to describe the bill.
Thank you, Madam Speaker. Dentists, as members of our healthcare community, want to do their part to help administer the COVID-19 vaccine to Minnesotans. Dentists are trained and often give injections to their patients. Administering the COVID-19 vaccine would be in line with what they are capable and trained to do. Under Minnesota law, dentists are also able to administer the flu vaccine. Dentists could serve as an additional healthcare provider and support large vaccine efforts across the state. They could play a valuable role in administering the vaccine in community settings and working with local public health. Dentists could also help vaccinate Minnesotans in rural parts of the state and help minimize the travel time necessary to get the vaccine. Over 20 states have already taken action to allow dentists to administer the COVID-19 vaccine, and more are in the process of doing so. Having a large, strong, and reliable provider workforce to vaccinate the population will help ensure that when the state receives vaccine doses in large numbers, that they get into the arms of Minnesotans as quickly as possible. Passing this legislation quickly will give the Minnesota Dental Association and the Minnesota Board of Dentistry time to notify dentists of this change and ensure that they get any necessary training. This could take a few weeks to make sure that dentists are available and ready to administer the vaccine. The bill includes a sunset provision of June 1st of next year. We should have a better sense on how the administration of the vaccine has gone by then, as well as the course of the pandemic overall, and we will be in a better position to determine if this should be a permanent change to the scope of practice of dentists. I encourage members to support this important legislation.
There are no amendments at the desk. The clerk will give the bill its third reading.
Third reading, Senate File number 475.
Third reading. Discussion to the bill. The member from Hennepin, Representative Hertaus.
Thank you, Madam Speaker, and thank you, Representative Freiberg, for bringing forward this 8-year-old bill that enables dentists to serve as part of our health care delivery system. Members, this bill was brought forward by myself 8 years ago, and we then were concerned about the avian flu, or the bird flu, and there was concern about international epidemic turning pandemic, actually, particularly from waterfowl that crosses the Bering Sea and into the northern continent of America. So members, as mentioned, this would aid quite a bit in making delivery of a vaccine in rural areas quite easier for many rural Minnesotans who have great distances to travel. As you're aware, many towns don't have a CVC or a Walgreens or a Minute Clinic, but most small towns do have a dentist. I wrote the governor last April, and I'm just surprised that it's taken 10 months to get around to this point of actually starting to do something about a suggestion that was offered many months ago. So with that, Representative Freiberg, thanks for updating the bill. It changes a couple of little things. MDH argued with me quite vociferously about the age limit. It had to be 19 years of age or older 8 years ago. Now it's been lowered to 16. And we've added the language of COVID vaccinations instead of influenza immunizations. Thanks, Rep. Freiberg, and I urge your green vote.
The member from Isanti, Representative Dowd.
Thank you, Madam Speaker, and thank you, members, and thank you to the author for bringing the bill. I just wanted to really thank Representative Hertaus, who brought this bill originally, I think 8 years ago, and it was something that he just completely thought of on his own as being a great improvement to provide access to vaccines for people that maybe didn't have a CVS or some sort of a pharmacy like that with a Minute Clinic or whatever in their small rural community. So this really is an access issue, and we're proud to support it. And I just wanted to recognize the fact that this is something that, and I'm not trying to say that to take anything away from the current author who's bringing this version, because this needs to happen, no question. But I did want to recognize that Representative Hertaus was quite ahead of his time when he thought of this years ago. And it really, I think, frankly, came from his background background and his own personal background in nursing. So appreciate that, and thanks for bringing it forward.
Any further discussion? Representative Freiberg.
Thank you, Madam Speaker. I appreciate the bipartisan support this bill is generating, and I would encourage everyone to vote yes.
The member from Carver, Representative Bowe. I didn't see your request to speak before I let the author go. Representative Bowe.
Thank you, Madam Speaker. I'm sorry I didn't mean to jump in after the author. I had put that in a while ago to talk. I just wanted to ask a quick question. I wondered if the author would yield for a question.
Representative Freiberg, will you yield?
Yes, I will.
He will yield. Representative Bowe.
Thank you, Madam Speaker. Mr. Freiberg, Representative Freiberg, thank you for bringing this bill forward. It's important to expand the options that are out there. My only question would be, there are many different varieties of vaccine that are out there, and many of them have different requirements for storage. And I wonder, are there any concerns if we expand to dentists with proper storage, given some of those must be stored at 20, 30, 40 below zero, et cetera?
Representative Freiberg.
Thank you, Madam Speaker, and thank you for the question, Representative Bowe. The Minnesota Dental Association believes that dentists would start by volunteering in large vaccination efforts. So, like, for example, the ones they might be having at the Excel Center. So in those sorts of settings, storage would not be an issue. If the dentist is registered as a provider in their office, they would have to be trained on vaccine storage. And I should mention, too, not all vaccines have unique storage requirements. Dentists would be able to administer those that don't in their offices, but they would be trained on the storage requirements. So if they did decide to offer a vaccine that does have unique storage requirements, such as being frozen in ultra low temperatures, they would have to procure the equipment to store them safely.
Representative Bowe.
Thank you very much. And again, thank you for bringing this bill forward.
Seeing no further discussion, the clerk will take the roll on the bill. Those who are voting remotely, please vote. Will the clerk call the names of those members who have not voted yet?
Damath.
Damath votes aye.
Damath, aye. Drazkowski.
Drazkowski, aye.
Drazkowski, aye. Frazier.
Frazier, aye.
Frazier, aye. Gruenhagen.
Gruenhagen, aye.
Gruenhagen, aye. Hamilton.
Hamilton, aye.
Hamilton, aye. Hausman.
Hausman, aye.
Hausman, aye. Lewick.
Lewick, aye.
Lewick, aye. Mariani.
Mariani, aye.
Mariani, aye. Mason.
Mason, aye.
Mason, aye. McDonald.
Donald, aye.
McDonald, aye. Morrison.
Morrison, aye.
Morrison, aye. Novotny.
Novotny, aye.
Novotny, aye. Poston.
Poston, aye.
Poston, aye. Thompson.
Thompson, aye.
Thompson, aye. Erdahl. Erdahl, aye. West.
West, aye.
West, aye. Wolgamott. Wolgamott, aye.
The clerk will close the roll. There being 131 ayes and 0 nays, the bill is passed and its title agreed to.